and answers at the end of this presentation. So the presentation is recorded. And Jan, if you want to hit the go button, that'll be great.
Lucy, mine disappeared, I think.
Okay.
You said you had yours out.
Yes, it'll take me a second.
I can try again if you would like.
Yeah, that'll be fine.
Okay, have to go to my email.
Yeah, I just did that too.
Hello, and welcome to Virginia Medicaid Waivers, a presentation by the ARC of Virginia. This is especially for people with developmental disabilities, family members, educators, and disability service providers who want to learn about the basics of Medicaid waivers for people with or at risk of developmental disabilities.
Is it up, Lucy?
Not the visual, just the sound.
Okay, okay. There it
The ARC
is.
of Virginia is a grassroots organization that was established about 67 years ago by families
There you go.
with disabilities who wanted all of the opportunities that people with disabilities without disabilities have to be accessible to people with disabilities. The ARC of Virginia represents people of all ages who are at risk of or have a developmental disability. Advocacy is the heart of our work. Our mission is to protect and promote the human rights of people with or at risk of DD and actively support their full inclusion and participation in the community throughout their lifespan. Our tagline is "A Life Like Yours." We're a private nonprofit organization and an affiliate of the ARC of US. There are over 20 local ARCs in Virginia, including the ARC of Greater Prince William and the ARC of North Central Virginia, just to name a few. In this presentation, we're going to cover Medicaid health insurance, Medicaid waivers, the waiver services, the eligibility criteria for waivers, how to apply for waivers, and let you know who you can contact for help and information when you need it. Let's look at the terms Medicaid and the term waiver. Medicaid is the insurance that pays for waiver services. A waiver waives the requirement that Medicaid services must be provided to all in the state. Instead, waiver services are only available to a select defined populations. Put together, Medicaid and waiver, Medicaid pays for waiver services that are only available to select populations. Medicaid waivers are also known as home and community-based waivers. They were created so that states can provide alternatives to living in an institution, such as a nursing facility, institution, or hospital-like setting to get needed services. So the waivers give states the flexibility to develop and implement alternatives to institutionalization. Medicaid waiver programs are overseen by two organizations, the Virginia Department of Medical Assistance Services, or DMAS, and the Federal Centers for Medicaid and Medicare oversee waiver programs. Every state has a waiver program, but the waiver programs vary differently between the states. If a state has a Medicaid program, then there are certain services that are required to be provided. These include things like family planning, health clinics, home health services, hospital, lab and x-ray, transportation, Medicare premiums, nurse midwife services, nurse practitioner, nursing facilities, physician services, and services known as EPSTT, which are only available to children up to age 21. States may also provide optional services in their Medicaid program. Virginia decided to provide the services you see on the slide: case management, home and community-based services, hospice, mental health, and immediate care facilities, optometry, OTPT, and speech therapies, podiatry, prosthetics, home health, and adult dental services. Note that waivers are an optional service. For people who have long-term care needs and for people of any age, waivers are a support system. Many people with DD have long-term care needs. The waivers offer a menu of services and supports so that people can live in the community rather than that nursing facility or institution. Very importantly, waivers are the only public funding source for people who need long-term disability supports. For some families, when their child graduates from high school, they suddenly realize there's no funding for supports and their child needs waiver services. So it's very important to plan ahead rather than wait until there's a difficult situation or a crisis of some sort. Because again, waivers are the only public funding source for long-term developmental disabilities supports. Some adults may have what's called the patient pay. Patient pay is where a person with Medicaid and a waiver has to pay a certain amount every month towards the cost of their waiver services. Adults with income over $1,310 per month may have a patient pay to pay each month. There are some exceptions for people who are working. Once a person is approved for a waiver and they have been approved for Medicaid health insurance, they have a Medicaid card, they have the Medicaid health insurance, they have access to the services in their waiver, and most likely they will be enrolled into a Medicaid managed care health program. A child or an adult may have private health insurance and Medicaid. Private health insurance is primary and Medicaid is secondary payer. If a person is enrolled in an employer-based health insurance program, the employee may be eligible for the Medicaid health insurance premium payment program known as HIP for kids and HIP for adults. For example, a child or an adult with a waiver may be on a parent's private health insurance plan. HIP reimburses the parent a portion or all of the total insurance premium for those who have health insurance plans that meet Medicaid requirements. To use this, it is necessary that a separate application be filed with the Department of Medical Assistance Services. And if you'd like more information about that, the number to call is 800-432-5924. And on the slide, we also have a link to where you can learn more about the HIP program on the website. Medicaid and Medicaid waivers are very complicated systems that have all kinds of terms. CCC plus, or Commonwealth Coordinated Care, is a term that means two separate things. There's the CCC plus managed health care, and there is the CCC plus waiver services. This is also a good time to point out that change is constant with Medicaid and waivers. Terms change, policies change, processes change frequently. As an example, we expect to see the CCC plus managed healthcare name change in the next several months. It's really important to stay up to date with the changes, and all kinds of changes occur. At the Arc of Virginia, we keep up with the changes and update our website, our presentations, and our social media. There are two Medicaid waiver programs that are typically used by people with disabilities. There's the Developmental Disability Waiver Program, or we will call it DD. And this waiver program has three types of waivers. They are the Community Living Waiver, the Family and Individual Supports Waiver, and the Building Independence Waiver. The CCC Plus waiver program is the second type of waiver that people with disabilities use. Let's take a look at these two waiver programs and compare them. The Dd waiver requires that a person has a developmental disability diagnosis. And if you don't know the definition of that, we'll define that in just a little bit in the presentation. The CCC plus waiver requires a disability diagnosis, so not a developmental diagnosis, and the person must have medical needs. The Dd waiver is considered a comprehensive waiver with over 30 supports and services. The services support people in their home and the community. It has medical supports, work supports, and a number of services that are skill building services. The CCC plus waiver only has 9 services for home, community, nursing, but none that are skill building services. There are no services for work or residential in the CCC plus waiver. The Dd waiver can provide up to 24/7 support. The CCC plus waiver does not have 24/7 support. The Dd waiver has a very large but needs-based waiting list. The CCC plus waiver does not have a waiting list at all. The Dd waiver is operated by the community services boards across the state of Virginia. The CCC plus waiver is operated by the local departments of health and social services. Financial criteria. When a person has a waiver, parent or family income never counts. There is no resource limit for children. So a child could have $15 million to their name and they could still have a waiver. However, once people turn 18, then there are financial limits. The income limit per month now in the year 2021 is $2,382 per month. The resource limit is $2,000. Waiver services are based on the need of an individual. A person may use one or more waiver services, and then their services may change as the person's needs change. The CCC plus waiver is what we're going to dive into a little bit more right now. You'll see on the screen the 9 services that are in the CCC plus waiver. And at this point, we're going to look a little bit more in depth at each of those services. Personal and attendant care services is where an attendant works one-to-one with the person with a waiver to assist with activities that we do every day: bathing, dressing, clothing, eating, mobility, and it provides supervision. An attendant may be only needed for a few hours per day or for more hours, depending on the person's need. For this service, the person with a waiver or family member may hire their own attendants. When the person with a waiver or their family is hiring attendants, that is called consumer directed. So that also includes the tasks of recruiting, interviewing, training, approving timesheets, supervising, and terminating attendance if that's necessary. In an agency-directed model, an agency provides all of the attendant and takes care of all those employer tasks. This service is also available in the Dd waiver. Assistive technology pays for technology that assists the child or adult to be more independent in activities of daily living. Devices are usually portable and may include specialized medical equipment, communication devices, or controls. Up to $5,000 is available per calendar year for assistive technology. This is also available in the Dd waiver. If someone needs a modification to their home so that it's more accessible, such as an accessible shower, ramp, widened doors, etc., environmental modifications can pay for it. Modifications may also be made to a vehicle such as lifts, hand controls, or a ramp. This is limited to $5,000 per calendar year, and it's also available in the Dd waiver. Private duty nursing is continuous care for up to 16 hours per day. It is only covered if the person's private health insurance does not provide this service. There's very strict medical criteria to get private duty nursing, such as being on a ventilator or some sort of other specialized medical technological support. This is also available in the Dd Waiver. Respite is a service that gives parents of the primary caregiver a break. It's available for up to 480 hours a year. It's also available as consumer directed and as an agency provided service. This is also available in the Dd Waiver. The Personal Emergency Response System, or PERS. These are electronic devices for the purpose of getting emergency assistance, think life alert, or it could be a medication management system where the person is reminded when to take their medication. This is for people who are not able to use a phone and need emergency assistance. The person has to be at least 14 years old, and the person must be left alone for a portion of the day. Also available in the Dd Waiver. If a person is living in a nursing facility or some institutional setting and they are going to move into the community, transitional services are available to help make that change. Up to $5,000 is available for expenses to move into a home in the community, also in the Dd Waiver. Adult day health care is not in the Dd Waiver, and adult day health primarily serves elderly adults who can't be left alone. People usually go to some sort of group setting site where there are social and recreational activities during the day. And again, it's typically for elderly people who can't be left alone, but younger people can also use that service. Let's look at what the diagnostic criteria are for the CCC Plus waiver. To be eligible for the waiver, the person must have a disability. However, mental illness does not qualify as a disability for this waiver. It is for people of any age. The person must have a medical or nursing need. This requirement means that many who do not have some daily medical or nursing need do not qualify for the CCC Plus waiver. We see many people who have intellectual disability or autism, and they are healthy, they're not taking any medicine, they don't have any physical health issues, so they usually will not be eligible for this waiver. The person must also meet the criteria for a nursing facility, meaning a person must be at risk, I'm emphasizing at risk, of placement in a nursing facility within the next 30 days. The assessment tool used to determine if a person meets the criteria is the Uniform Assessment Instrument, or UAI. The UAI assesses a person's social, physical, and functional abilities. The screening is completed by a nurse from the health department, or if the person is in the hospital staff does the screening. Usually the nurse will come to the home of the person who's being screened for that waiver. To apply for this waiver, contact your local Department of Social Services or your local health department. Different localities have different starting points to get a screening. The screening is done in a person's home, or depending on pandemic conditions, it may be done virtually. When you call to request the screening, be prepared to answer a few questions and give certain information, such as you or your child's disabilities, physical health diagnoses, be able to name whatever CCC Plus waiver services are needed. One big thing we hear is families call us and they want to get therapy for their child and they want to have it paid for through Medicaid. That is not the purpose of getting screened for a waiver. It's that the person has a need for one of the CCC Plus waiver services, not that it's a way to get Medicaid to pay for therapy. When the screening is done, you do not have to have Medicaid at that point, but if you are approved for a waiver and you don't have Medicaid, then you will need to submit a Medicaid application. We're going to move on over to the developmental disabilities waiver, the waiver that has 30 plus services and supports. As we mentioned earlier, you may recall there are 3 types of Dd waivers: community living, family and individual, and the building independence waiver. So within these 3 waivers, there are different services. The same services are not in every waiver. A key point is that among these 3 types of waivers, there are some services that are the same, but there are some services that are not in each of the waivers. So the thing to remember is different waivers have different services. So we can take a little look at the 3 types of waivers and who they fit for. The building independence waiver is only for adults who have minimal support needs, and it has far fewer services. It's usually the people with this waiver live in their own home or apartment. The family and individual waiver is for people of all ages. The person may live in their own home, apartment, or with friends or with their family. It includes extensive supports, including medical and behavioral. It can provide up to 24/7 support. The community living waiver also serves people of any age, may live in their own home or apartment, or with friends, or with their family. It also includes extensive supports in the areas of medical and behavioral, and can provide up to 24/7 support. What's unique about the community living waiver, it's the only waiver that has the segregated group home and sponsored residential service. That is the key difference between the family and individual supports waiver and the community living waivers. I want to look a little bit at the residential services that are within the Dd waiver, and this will illustrate for you that different waivers have different services. So the first service you see over on the left is independent living services, and that's only available in the building independence waiver. That's a service that helps a person live independently in their own home. Maybe they need help with learning how to use a stove or some other aspect of their life where they're living independently. And that only offers a few hours a month or a week for services. We look down at shared living. That's where the person is living with another person and there's certain responsibilities of the other person. And that's available in all 3 waivers. We're going to jump on down to sponsored residential, and you will see that it's only available in community living. And if you're not familiar with sponsored residential, that's a service where a family is paid to provide care and support 24/7 to a person with a developmental disability. They may not have more than 2 people with disabilities in their home. And then I think everybody's familiar with group home residential services. Many people with waivers do not know that group homes are not the only way a person can live who may need up to 24/7 supports. With the family and individual supports waiver, it is possible to do that. And not everyone needs or wants to live in a group setting. In the Dd waiver, there are a range of services for people to access that are related to employment and other times when someone is not in school or working. For employment-related services, there's support employment, workplace assistance, and benefits planning. Group day programs, community engagement, and community coaching serve youth and adults and take place when a person is not in school or employed. There are more Medicaid waiver services, including companion services that can be agency or consumer directed, electronic home-based services, community and employment transportation, community guide, peer mentor supports, skilled and private duty nursing, and behavioral supports. I want to point out peer mentor. That's one of the newest waiver services. It's for people age 16 or older who have a goal that they want to achieve. And a mentor, a person with a disability, can assist them with how to meet that goal. Peer mentors are people who have lived experience as a person with a disability who are paid to assist the mentee to help meet their goal. If you are interested in being a peer mentee or a peer mentor, please contact the ARC of Virginia. There are very specific definitions and criteria for waiver services, and there's no way in this presentation that we can drill down on all of this. So to read in detail about the services, you may go to our website for information, and our contact information is at the end of this presentation. So what are the eligibility criteria for the Dd waiver? For the Dd waiver, a person of any age must have a chronic disability that occurred before the age of 22. Like the CCC plus waiver, a sole diagnosis of mental illness does not qualify. So a person may have a mental illness, but they must have another disability that's considered a developmental disability. The person needs or will likely need lifelong plan services. And they must have substantial limitations in 3 of the areas of life activity. The areas of life activity that are considered are self-care, communication, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency. And there's the slide with the information about the criteria for a developmental disability. Here are some examples of conditions that may be a developmental disability: autism, brain injury, cerebral palsy, Down syndrome, intellectual disability, muscular dystrophy, epilepsy, or spina bifida. Not everyone with a developmental disability diagnosis is going to qualify for the Dd waiver because a person must meet the functional criteria. There are people who may have 1 or more of the conditions above, but they do not have significant functional limitations. The VIDES, or the Virginia Individual Developmental Disability Eligibility Survey, is the screening tool that's used to determine if the person meets the functional criteria. The VIDES looks at 8 different life areas to assess what support a person needs in areas such as communication, health, decision-making, etc. The staff from the Community Services Board administers the VIDES. Usually the staff from the CSB will meet with an individual in their home or at the CSB office and administer the VIDES with the person, any family, or any other people that they want to have with them. The type of help that a person needs is assessed through the VIDES. So it's looking at the person to see what they need and the frequency and the type of help is needed. It looks at whether the person needs another person or technology to do basic activities. How often does this person need help? For example, if a 12-year-old needs assistance getting dressed, do they need someone to tell them what to wear? Do they wear their appropriate clothing? Does someone have to get the clothes out of the drawer or closet? Does someone have to physically help put the clothes on, or just tell the person what to put on? Consider that the person is being assessed with no supports or family available. So back to the 12-year-old, think about the 12-year-old being in the house by themselves, no one else is around. How do they do that task of getting dressed? This is a time when you focus on the challenges. It's not the time when you talk about how well your loved one is doing. If you're interested in getting a screening for the waiver, the ARC of Virginia strongly encourages you to learn more about the waiver programs, and that before you request a screening, you learn more about the screening processes. Advanced preparation is really important. Get a copy of the VIDES or the UAI and review those documents in advance. We also have them available on our website. To start the process of applying for a Dd waiver, you request a screening from your local community services board. For example, if you live in Prince William County, you call the Prince William Community Services Board. If you live in Fauquier, you call the Rappahannock Rapidan Community Services Board. If you don't know who your community services board is, the website that we have there, vacsb.org. You can put in the area that you live in, and it will provide you with your local community services board. When you request the screening, report your family member's disability or developmental delay for little ones, and be sure to say why you want the screening. The Dd waiver has that very large but needs-based waiting list. The wait list is not a chronological list. So somebody could be on that list for a month and get a waiver, or some people have been on that list for 10 years or more. The advantages to being on the wait list include a program called IFSP, or the Individual and Family Support Funding Program. That's administered through the Virginia Department of Behavioral Health and Developmental Services. And that's a program where once a year, there's an open application period where people may apply for some sort of support or service to be paid for that would be helpful for the person on the waiting list. Rental assistance is also available for people who are over the age of 18. And if they are able to live away from their family home, then rental assistance is available to them, assuming they have enough supports and services to make that successful. So we have covered a lot of information in a pretty short time, and it is a very complex system. If this is the first time you've heard this information, it can be very overwhelming, but the ARC of Virginia is here to help you through this process at whatever level of support you need. We do one-to-one consultations by phone. You can email us questions, and we have detailed information on our website and on our social media sites. Our website is www.thearcofva.org. We do waiver mentoring and provide information and resources, so you may call or email info@thearcofva.org. We also have educational videos about all kinds of issues and services related for people with developmental disabilities and their families, and that's on our YouTube with the ARC of Virginia. We hope you have found this information helpful, and thank you for learning with us.
Where's that music coming from? Is that your music? Not me either. Okay. Somebody has it on, so, aha. Are you on now, Lucy?
I am. Mhm.
Okay.
And
People
no
can-
music.
Yeah, it had gone to the next thing. If anybody has questions, I'm having trouble getting back on, so you might have to see them in the chat or the Q&A?
Okay.
Jan, there was one asking if this was recorded and I answered yes.
It is recorded. I will send out the links next week.
And it's also available on, if you go to YouTube on the Arc of Virginia, you'll
Mhm.
find it there. So I have to really thank Jan for kind of rescuing me with making sure that the presentation got up. It was also very, my voice was rather muffled sounding. It wasn't like that last night when we did this. Maybe it's because of all the rain. So I apologize for that. So I see a question from Caitlin.
Caitlin.
Mhm. You had mentioned rental assistance as part of the Dd waiver waitlist. What does that look like? Okay, good question, Caitlin. Rental assistance is only available to people who are 18 years or older, who are on the developmental disability wait list. So if someone as young as 18 is on the wait list, they can apply for rental assistance. But that means they must move into their own home, their own apartment, whatever rental type of unit that they want to live in. So you cannot be living with your parents because this is a service that is the rental assistance program is there to help people live more independently. If someone is on the Dd waiver wait list and they want to look into this more, you contact your contact at the Community Services Board. They are the ones who, that's the entry point to find out about rental assistance. Okay.
You have to repeat the VIDES once you're receiving CCC plus.
Do you have to? Okay, so the VIDES is the screening tool for people who are on the Dd waiver and on the Dd waiver wait list. And the VIDES is supposed to be revisited, redone at least once a year. Now, part of your question has once we are receiving CCC plus, do you mean CCC plus waiver or do you mean CCC plus health insurance? If that's connected at all, we'll try and clarify that. But that's only for people with the Dd waiver or on the Dd waiver wait list. Okay. My daughter is 13, diagnosed in her school with intellectual disability. Yes. And you want to know if your daughter can be screened for the Dd waiver? Yes, indeed. Any age can be screened for the Dd waiver. So thank you for that question. Maryland. So theoretically, you could be in an apartment for 10 or more years before you get assistance. You can, if you're asking about that in relation to rental assistance, that's possible. But if you're talking about being on the wait list for a Dd waiver and getting those services, it's possible some people have been on the wait list for 10 or more years. The developmental disability waivers are based on need. Who has the greatest need? Who's most at risk of losing their community placement, not being able to be served in the community? So those are the people who get waivers first.
And Raphael followed up by saying it's the CCC plus waiver that he's on.
Okay. Hi, Raphael. If you're on the CCC plus waiver, the VIDES does not apply. Now, that kind of brings me to a point about a person may have the CCC plus waiver and they may be on the Dd waiver wait list. So if you're on the Dd waiver wait list, once a year, at least once a year, you should have the VIDES reviewed and gone over again. And that is really, really important at this time right now. Everybody on the Dd waiver wait list is being contacted and reassessed, shall we say, to make sure that their VIDES is up to date and that their priority level on the Dd waiver wait list is accurate. So this is a huge undertaking by the community services boards. So if you have not been in touch with your community services board representative, be sure to do that. I will also mention that this is such a huge undertaking to reassess everybody and determine what their priority level is, that state personnel could be contacting you. So make sure you listen to your messages. If you don't pick up your phone all the time, they will try to contact you twice, and then that's it.
Criteria for younger children under the age of 3 for a waiver.
So if we're talking about the Dd waiver, the VIDES assesses people according to their age. So there are 3 different versions of the VIDES. So for a child under 3, there is the VIDES assessment for children age 3 and under. So the criteria is the same. You have to either have a developmental disability or be at risk of a developmental disability. And then the child's functional needs are assessed according to the child VIDES, and the child is assessed compared to a child who is typically developing. For the CCC plus waiver, has to be determined that there is a disability, and there has to they have to go through the UAI screening, and that is a very, very rigorous screening. And as I mentioned in the presentation, where some people don't meet the criteria is they don't have some sort of medical or nursing need. So
Let me get, I have a question in the Q&A that I want to bring up before we get to the others here. What's the difference between CCC plus managed care and CCC plus waiver?
Okay.
That's why I wish they changed the name.
And we think that might happen in the next few months,
Right.
Amazingly. So yeah, this is part of Virginia's very complex system that can be so confusing. So we have these 2 things that are named CCC plus. So there is the CCC plus Medicaid waiver that has services that people use. In Medicaid, Department of Medical Assistance Services, most people are put into a CCC plus managed care program. So that means you have a care coordinator with whatever managed health care organization you go with. There are 6 managed care health organizations: Anthem, Optima, United, etc. So one is the actual waiver services, the other is the managed healthcare program. Now, if you get a waiver, most people, as I said, are put into a CCC plus managed healthcare program. Some people are not put into that. If a person is using the HIP program, Health Insurance Premium Payment Program, then they are not put into a CCC plus managed healthcare program. Does that explain it well enough, Jan, or?
I think so, but I think you all will have to read or review perhaps the recording once it's set out. It takes a long time to learn the difference between all of this. It's not something you can know just, oh yeah, I've got that. Okay, another question. Are group homes and apartments on the same wait list?
Are group homes and apartments on the same wait list? So group homes are in the developmental disability waiver, but you cannot, if you're on the wait list, you cannot go into a group home. You don't get rental assistance for that or anything. Sometimes I'm trying to make sure I'm getting the right context of how people are asking questions. So apartments, if someone wants to use the rental assistance program, they can be on the Dd Waiver wait list and apply for that. And Marilyn, if I'm not answering your questions in the right context or whatever, keep asking questions, or everyone, feel free to call me. We really do one-to-one and go through the VIDEs with you, answer all the questions that we can. Like Jan said, it's just a huge amount of information in a complex system. Okay, Irma Guzman. I was told by a friend of a child that they qualify for Medicaid. That is not true.
No.
So Irma has heard that if a child has a developmental disability, then they qualify for Medicaid. That is not true. A child, something just popped up. So a child, so someone under the age of 18, if they have a developmental disability and they want to get Medicaid, then their family's income is going to be considered. So they're going to look at the whole household, the whole family, and see if they meet the financial criteria, which is usually a fairly modest income. So people, families with minor age children, children under the age of 18, if that child has a waiver, then Medicaid does not look at the family income.
Okay. Other questions?
So parent income is never considered. Never.
If they have a waiver.
If you're on a waiver.
That's the difference. There's difference between Medicaid and Medicaid waiver.
So yeah, Medicaid is the health insurance, and then waiver is the services. When you have a waiver, you have all of the Medicaid health insurance available to you, all those services we talked about, primarily medical, hospital, physician, etc. And then there are the waiver services. Okay, is the DMAS 7 form coming back? I'm not sure about that, Raphael. I kind of think it's already, it is being used.
Yeah.
But I want to be careful about that answer.
Other questions? Well, thank you everyone for coming, and Lucy, thank you for participating once more. I learned something every time I listen to this presentation. So thank you. And thank you, everyone.
Thank you.
Stop recording. Okay.